Eh, what's up, Doc?
Hello everyone, welcome back to Lupus Tips. I'm Susie Eaglesfried from Lupus South Africa and Andrea's gift. In this episode, we'll be discussing the heart or cardiovascular disease. It's very important that people with lupus take care of their cardiovascular system because it's the leading cause of death among those with lupus. It's imperative that we thoroughly investigate and address this matter. It's just another step making sure that you are on top of your health. So let's get into it.
Lupus, an autoimmune disease in which your body attacks itself in healthy tissues. It affects people in a lot of different ways. The painful, damaging inflammation it causes can occur not just outside on your skin, but also in your organs, such as your kidneys and your lungs. Over the long term, lupus also raises your risk for cardiovascular disease, CVD. CVD is a group of conditions that affect your heart and blood vessels. CVD is the leading cause of death among people with systemic lupus erythematosus, SLE, the most common type of lupus. What's the connection between lupus and heart disease? The inflammation that results when your autoimmune system turns on itself can harm the thinner inner lining of your blood vessels, known as the endothelium. This can cause CVD to start earlier in life than usual. Especially true for young women with lupus, who are 50 times more likely to have a heart attack than women in the same age group without SLE. The steroids used to treat lupus can also damage your heart health because they may lead to a high blood pressure, high cholesterol, and diabetes. These conditions raise your risk of heart disease, which goes up when you take higher doses and spend more time on steroid medication. That's why rheumatologists should prescribe steroids only when it's necessary and not for too long. What are the risks? The risk of heart disease is much higher in people with lupus than those without. More than half of the patients with SLE will get cardiovascular conditions related to lupus. These include arteriosclerosis. This is the most frequent type of CVD in people with lupus. It happens when cholesterol and other substances build up in your arteries. Eventually, this build up, called plaque, restricts the flow of the blood to your heart, brain, feet, legs, and other parts of your body. Inflammation of the heart. When inflammation affects the pericardium, the sac around your heart, it's called pericarditis. It affects around 1 in 4 people with lupus. You may be especially likely to get pericarditis when your lupus symptoms flare up. Inflammation can also strike your heart walls and valves, a condition called endocarditis, and your heart muscle, which is known myocarditis. Vasculitis. The inflammation in your blood vessels stops the normal flow of blood to your organs. Hypertension, high blood pressure. It affects about half of the people with lupus and raises your risk of heart failure and heart attack. APS, which is called antiphospholipid syndrome. APS can cause clots in the vessels that supply blood to your brain, heart, and lungs. These clots can cause heart attacks and strokes. Problems with blood vessels under your skin. These include conditions such as Raynaud's phenomenon, levorectularis. Levorectularis is a skin symptom. It refers to a net-like pattern of reddish-blue skin discoloration. The legs are often affected. And palmaerythema, that can change the look and color of your skin. Most of these conditions can lead to other CVD problems as well. People with SLE are more likely than others to have a heart attack, heart failure, heart rhythm problems, arterial fibrillation or flutter, stroke caused by the clots that block a blood vessel, venous thromboembolism, which are blood clots in deep veins. What should I look out for? If you have lupus, stay alert on how you feel. Common symptoms of an inflamed heart, for instance, include chest pain, swelling throughout your body, fatigue when you're active, difficult or painful breathing, problems with your heartbeat. Symptoms of vasculitis can include fever, weight loss, rash, eye and brain problems, white and blue fingers, toes, red palms, and lace-like patterns on your skin are signs of problems with blood vessel just beneath your skin surface. How can doctors help? The complicated heart and blood vessel problems that lupus can cause may mean you need a team of doctors with several specialties. Together, they can design a treatment plan to lower your risk of CVD and treat any problem you develop. Start, ask your GP about any concerns related to lupus and your heart. You may or may not need to see a cardiologist or a heart doctor. The decision depends on whether you have any symptoms and whether you have other risks for CVD besides lupus. Cardiologists can order tests to check your heart health. They can also work with a doctor who treats your lupus to adjust your medication to help protect your heart against future disease. The tools used to diagnose CVD depend on the condition the doctor suspects. They include blood tests to measure your cholesterol, for example, angiography, chest x-rays that look at the blood flow to and within your heart, electrocardiography, commonly called EKG or ECG, tracks your heart's electrical activity. Echocardiography, to check how well your heart's valve and other parts are working. Your doctor will tailor your treatment to your particular issues. To address long-term risk posed by arteriosclerosis, for example, you may need to take a drug that controls your cholesterol. Pericarditis. Your doctor may prescribe steroids or NSAIDs, which is anti-inflammatories, swelling and irritation of the thin sac-like membrane surrounding your heart, the pericardium. If you have myocarditis, your doctor will treat you with high doses of steroids. It's the inflammation in the middle layer of your heart. Myocarditis is usually caused by a viral infection. For endocarditis, they may prescribe antibiotics to prevent or treat infection. How to protect your heart health. Even with the challenges posed by lupus, you can take steps to protect your cardiovascular health. don't smoke. Follow a low-fat, low-cholesterol diet that focuses on unprocessed foods. Keep your salt intake low. Maintain a healthy body weight. Exercise at least 30 minutes a day. Low-impact exercises such as yoga, swimming, and walking will also improve your joint and muscle pain.
In conclusion, controlling disease activity, preventing disease flares are the most helpful measures in preventing and managing the heart involvement with lupus. Various lifestyle modifications are recommended for all lupus patients to reduce the risk of coronary artery disease. Protect your heart as much as possible, because cardiovascular disease is the leading cause of death among those with lupus. Take good care of it, and it will take good care of you. If you enjoyed this video, please click the like button below. Follow us on Facebook, Instagram, and TikTok, and subscribe to our YouTube channel, Andrea's Gift Tweens and Teens, Lupus South Africa, and Susie Eagles Flight. Thank you for watching, and remember, giving up is not an option. Bye.
That's all, folks.